One member of the Gang of Six is Iowa Republican Senator Charles Grassley. He joins us this morning from Capitol Hill. Senator, it's great to see you back in Washington. I hope the month of August was enjoyable for you.
It was very enjoyable.
Terrific. Hey, listen, during the August recess, you said of the efforts to craft a bipartisan bill there in the Senate, quote, I don't think it's going to be possible to work it out with the administration because they're all over the field. Now that you're back there on Capitol Hill, are you going to walk away from this, or are you going to stick with the Gang of Six and try to come up with a plan?
Well, we won't know until we meet this afternoon at 2:30. The president has, the good and bad of the president speaking this week is that we've had to speed up the work of our group to have something ready. The other thing is that the president, and that's bad because we should have probably taken a little more time than just over this weekend. And then the other issue is that the president, if he does come out with specifics, probably would make up for that criticism that I gave during August that they were all over the ballpark, and they were all over the ballpark.
Now, one of the proposals being floated, and it was handed to you over the weekend, is from Senator Max Baucus, the chairman of the committee. It's no public plan. Nonprofit co-ops would provide insurance for people who are uninsured. It expands Medicaid eligibility as well, and then levies a fee on insurance companies who provide high-end Cadillac plans to help pay for the overall reform. Is that something that you can support?
Well, one thing about the co-ops, if they're going to end up just the way we've known co-ops for 150 years in America, the answer is yes, because they're consumer driven and all the consumers benefit from it. They're organized by members. There's no federal government running the co-ops, etc. And that's the way that Senator Conrad has devised them. And I've been discussing that with him, and along the lines of what he suggested, it's very favorable. Just in case that somebody comes along and wants a federal board, the federal government to accept risk, so we end up with a health care Fannie Mae, then that would be a no-no for me. In regard to the tax that you ask about, the only thing I would suggest is both Congressional Budget Office and the Joint Committee on Taxation has said that those costs will be passed on to the premium holders. So it's going to drive up the cost of insurance, maybe at a level of insurance that we shouldn't be subsidizing in the first place. But the case is that the extent to which consumers pay for it, that is a concern, as opposed to if the corporations would have had to pay for it, the people providing the insurance, it probably would be a better approach.
Senator, of course, the president's got this speech to a joint session of Congress tomorrow evening. He kind of laid down the groundwork for that yesterday, a speech to the AFL-CIO, in which he took on people like yourself who have been critical of his plans for health care, saying, what have you done lately? Let's listen to what the president said.
Yeah.
What are you going to do? What's your answer? What's your solution? And you know what? They don't have one.
Senator, the president charges you don't have a solution, so let me ask you now, what is your solution to health care reform? What's your plan?
Well, don't forget, I've been working the last 3 or 4 months with Senator Baucus one-on-one, and then later with the group of 6 to come up with a bipartisan plan. And it seems to me that the bipartisan approach is the best. And if you look at the president during his campaign, he wanted to be post-partisan. And it seems to me like those statements yesterday were very partisan, contrary to what he promised in the last campaign. But I would be working towards a bipartisan effort. And if we don't get a bipartisan effort, then of course there is so many things in what I've been working towards that could easily go into my plan or a Republican plan. And then don't forget that there's already 4 Republican plans out there introduced by other members of our caucus, but because we're the minority party, you at CNN and other places haven't given our plans much publicity because I suppose we're in the minority, and you want to help the president so much, so that I hope that if we don't have a bipartisan plan, that you'll start giving some attention to the Republican plans that are out there.
Right. Well, I can assure you, Senator Grassley, it's not our intention to help any politician, president, you, anyone else. We're just merely telling people what's out there, and we will redouble our efforts to illuminate Republican plans. Let me ask you this question.
Thank you.
You're up for re-election next year. You recently sent out a fundraising letter in which you said to your constituents, quote, "We ask for your immediate support in helping me defeat Obamacare." Ezra Klein from the Washington Post took a look at that, and he said that, speaking of you, he is creating a campaign premised on his role in stopping Obama's health care reform effort. It's not clear how he could pivot to save it, even if he wanted to do so. So my question to you is, have you left yourself, with this pre-election campaign, Senator, any room for compromise?
Absolutely yes, because you know what Obamacare is in the public's minds, my constituents' minds. It's all that public option. It's all the eventual nationalization of health care in America, run entirely by the federal government. And that letter associates Obamacare with the public option, and the people of my state, and I think most of the people in this country, don't want the government to take over federal health care.
All right, Senator Charles Grassley, it's good to talk to you this morning. We look forward to the results of your meeting with the Gang of Six later on today. Appreciate it.
Thank you.
Coming up now in 37 minutes after the hour.